Good day, everyone. There are two tiers of our basic infection control. Number one is we have your standard precautions. When we talk about standard precautions, these are precautions that you are going to apply to any client at any time and at any given situation. So if there's any risk of exposure to blood, all types of body fluids, excretions and secretions, open skin lesions and rashes, mucosal surfaces, and contaminated items or surfaces, you need to apply your standard precaution. We will be discussing further your standard precaution on a different video. The second tier of our basic infection control is we have your transmission-based precaution. Your transmission-based precautions are precautions that we are going to apply in addition to your standard precautions once you confirm or you suspect the patient's specific infectious condition. So the type of infectious disease the patient has will tell you what type of transmission-based precaution you're going to apply. Let's, for example, if you are suspecting or if you confirm that the patient has tuberculosis, then you are going to apply airborne precaution. Same goes also with those patients who have multi-drug resistant organism. So those organisms will tell you that you need to apply contact precaution. There are three types of our transmission-based precaution. Number one is we have your contact precaution. The second one is we have your droplet precaution. The third one is we have your airborne precaution. Now let's discuss these types of precaution one by one, starting with your contact precaution. Precautions are precautions that we are going to use in order to reduce the risk of transmission of infection that is transmitted through contact with the patient or with the patient's environment. Examples of our contact transmitted infections is we have your multi-drug resistant organism like your VRE and your MRSA. We also have your patients who have eye infection like conjunctivitis, patients who have enteric infection like your Clostridium difficile, patients who have wound and skin infection. We can place patient under contact precaution to a single room if possible, but we can cohort patients under this type of precaution if they have the same organism or disease. Now, if you are a nurse or a healthcare practitioner that is handling patients under contact precaution, the two most important PPE that you should never forget to wear is we have your gloves and your gown. All waste of your patients under multi-drug resistant organism should be discarded in the black bin. But if the waste of a patient under contact precaution came from an infected wound or the waste is dripping or soaked with so much blood and body fluids, then you need to discard all those waste in yellow. For patients under any type of precaution, limit or do not transport the patient unless it is medically necessary. And if you're going to transport the patient, make sure that you need to inform the receiving department of the patient's status so that they also will prepare what are the PPEs that they need or what are the precautions that they are going to prepare once the patient is already in their unit. Aside from that, make sure that you are going to cover, especially under contact precaution, if the patient has any skin lesions, you need to cover it with a dressing. You need to change the patient's gown and you need to cover the patient with a blanket. Okay. During transportation of patient under contact precaution, the transporting personnel should not wear PPE during transport. He or she should be wearing PPE at the destination site or area. However, if during transport there is a need or there's an instance that you need to come in contact physically with the patient, then you can wear your PPE. Aside from that, you can also tell your patient that during transport, avoid touching any surfaces and always perform hand hygiene. The isolation poster for our contact precaution is we have your color green. Now, once you saw this picture or poster outside the patient's room, make sure that you need to observe and follow the protocols what is written under contact precaution. When transporting patient, make sure that you're going to highlight our transportation cards. You can hang this one at the handle if you're going to use to transport wheelchair or at the side if you're going to transport the patient using a stretcher. The reason why we need to highlight these transportation cards or poster so that our healthcare workers will be aware what type of precaution the patient has. The second type of our transmission-based precaution is we have your droplet precaution. Now, droplet precautions are precautions that we're going to apply to reduce the risk of transmission of any infection that is transmitted through large droplet particles. Meaning to say the size of your particle is greater than 5 microns in size. This will happen, droplet transmitted infection will happen once the source patient is going to cough, sneeze, or even talk. Droplet transmitted infections are infections that will travel to at least 3 or more feet from one person to the other. Common examples of our droplet transmitted infection is we have your pneumonia, influenza, meningitis, mumps, rubella, your MERS-CoV and your COVID-19 are part of your droplet transmitted infection. If you are a nurse or a healthcare practitioner who is handling patients under droplet transmitted infection, the most important PPE that you should be wearing and you should never forget is we have your surgical mask. Patients under droplet transmitted infection should be admitted in a single room if possible. However, if there's no available room, we can cohort patients with the same disease condition. If you're going to cohort patient, make sure that there is a 6 feet distance from one bed to the other. Patient under transmission-based precautions, specifically your droplet precaution, try to avoid transporting patient outside the patient's room unless it is medically necessary. Now, if you're going to transport the patient outside the patient's room, make sure that you're going to inform the receiving department. You need to let the patient wear mask if he or she is capable of wearing mask. And you need to teach the patient also about respiratory hygiene and your cough etiquette. Now, the one or the healthcare worker who is transporting the patient, it is not necessary for him or her anymore to wear a surgical mask. As much as possible, try to dedicate non-critical patient care equipment to those patients under isolation precaution, like your patients under droplet precaution. So this is one of the example of your non-critical care equipment or patient care equipment. Do not forget to highlight this transportation card if you're going to transport the patient outside the isolation room. The color of our isolation poster for droplet precaution is we have color red. So once you see this poster outside the patient's room, make sure that you're going to follow the protocols or guidelines that is written in this poster. All waste generated to patients under droplet precaution should be discarded in black, unless otherwise if the waste is soaked or dripping with blood or body fluids, then you need to discard those waste in yellow. Patients under droplet precaution like your COVID-19 or your MERS-CoV, if you're going to perform aerosol generating procedure, then you can raise the level of your precaution to airborne. The third type of our transmission-based precaution is we have your airborne precaution. Now, airborne precautions are precautions that we're going to apply to reduce the risk of any infection that is transmitted by microorganisms that is 5 or less than 5 microns in size. Examples of our airborne transmitted infection is we have your measles, we have your tuberculosis, we have your varicella or your chickenpox, we also have your disseminated herpes zoster or your shingles. Diseases that is under airborne transmitted infection, if the patient is going to cough or sneeze or even talk, the particles that they're going to produce will be suspended into the air because the particles are lightweight. It will stay into the air for a matter of hours and it can travel to a long distance. So if you suspect or if you confirm that the patient has infection that is transmitted through airborne, make sure that you're going to admit those patients on a negative pressured room or in your airborne infection isolation room. This room is a negative pressured room, meaning to say it sucks air so that any infection that is inside will not go out and spread to other healthcare workers. As a healthcare worker who is handling patients under airborne precaution, make sure that the PP that you should be wearing inside the patient's room is we have your N95 mask if you pass the fit test. Now, if you fail the fit test or the mask is not available in the hospital, you need to wear your PAPR or your powered air purifying respirator. Like any other types of your transmission-based precaution, avoid as much as possible transporting patient outside the isolation room unless it is medically necessary. Now, if you're going to transport the patient outside the patient's room or the isolation room, make sure that you're going to perform or you're going to inform the receiving department and you need to highlight your transportation card. Now, if the patient can tolerate wearing surgical mask, the healthcare worker can wear surgical mask as well. But if the patient cannot tolerate wearing surgical mask, the healthcare worker should wear his or her N95 mask. The color of our transportation poster under airborne precaution is we have color blue. So once you see this poster outside the patient's room, you need to follow the protocols or guidelines that is written in this poster. All waste generated to patients under airborne precaution should be discarded in yellow.